My question is to the Minister for Health. Minister, on the 1st of November 2021, your predecessor, also the Premier, was proudly photographed with other senior health officials. And the headline of that story was termination letters sent to states' unvaccinated health staff. To be more precise, 170 essential health workers lost their job in 2021. These employees have been sacked under the same provision of the Code of Conduct as the one reserved for those sacked for child sexual abuse. They are on the same list as those sacked for the heinous crimes of sexually abusing children. Minister, other departments have allowed their workers to return. The Department of Health is the only one that hasn't done so and continues to list those employees as suspended. I have raised this many times with your predecessor, who I believe has not resolved the issue, being rather distracted by other more pressing matters. Minister, do you believe that returning 170 essential health employees back to work will help our health system? Will you commit to restoring to these people the dignity of being able to work again in their chosen profession?
Honourable Minister for Health.
Thank you very much, Mr Speaker, and I thank the honourable member for her question, her interest in this important matter. And first of all, I'd like to commend the many thousands of healthcare workers and Tasmanians who contributed to keep us safe in Tasmania during a very difficult time, particularly with respect to our COVID response, Mr Speaker. And I look back on the minimal days of lockdowns, look at the nation-leading vaccination rates, I look at and compare our elective surgery closures, I compare our red-hot economic recovery and the efforts of our government, Mr Speaker, to deliver and protect both lives and livelihoods. So I say that up front. And I've recently met with the Director of Public Health to gain a better understanding of where we're at with respect to COVID and note that the risk levels have gone from moderate down to low. I'm also advised, of course, the total of 312 deaths since 2020 caused by the contribution of COVID, and I offer my condolences, Mr Speaker, to family and friends impacted. Our government will continue to be informed by public health advice, as we've done throughout the pandemic. Tasmanians can continue to protect themselves from illness and, of course, keep their vaccines up to date. You asked about the Health Department in particular, and in regard to the vaccination requirements for health workers, that was in accordance at the time with public health directions made under Section 16 of the Public Health Act 1997. Persons working in a medical or health facility, persons providing health and medical services or treatments, and all Department of Health employees were required to be vaccinated against COVID-19, Mr Speaker. The direction first took effect on 31 October 2021, with workers being required to have their full primary course of vaccination by 8 January 2022 unless they had a medical exemption. So I think that's all on the record, Mr Speaker. I'm advised that the Department of Health complied with the direction by standing aside some non-compliant workers and directing them to provide evidence of compliance. And as the Public Health Emergency Declaration concluded on 30 June 2022, the Department implemented a risk management plan for mitigating the risks of transmission and harm from COVID-19, and this is consistent across government in terms of the risk management plan that is put in place, Mr Speaker. The plan implemented new control measures to keep its sites open to ensure the continued delivery of health and other services to the Tasmanian community. The risk management plan recommended that workers remain up to date with their COVID-19 vaccines rather than mandating staff are required to be vaccinated, including boosters. You asked also about the numbers of actual numbers of staff who've been stood down. You've made reference to those numbers. I'd need to seek further advice with respect to that and the other matters in your question that perhaps haven't been fully answered here, and I'll ensure that you're updated accordingly. Thanks very much, Mr Speaker.
Honourable Leader of the Opposition.